Hello everyone, please contact Professor Robert for a sample or a customized paper of the following or any other assignment. NUR1102. Literacy and Communication for Healthcare. Description. Task 2. Scenario task, 35%. Instructions. Communication within nursing practice is often challenging, and nurses need to be equipped with concepts and strategies to respond effectively in these situations. Select one of the two communication scenarios presented below and write a 1200-word essay that analyses the scenario in relation to nursing communication. In your assignment, you need to draw on supporting literature or concepts taught this semester, for example person-centered care, family-centered care, nursing governances, etc., to strengthen and support your assignment. These concepts in turn reinforce your choice of a communication framework that can be applied to overcome the ineffective communication displayed in the scenario, for example, managing aggression, assertive communication, managing conflict, de-escalating conflict, self-awareness, resilience and self-care. The concepts in the communication framework work together to enhance the effectiveness of nursing communication tools to be improved in the scenario, for example SOAP, SOAPy, ISBR, ISBR, handover, etc. Scenario 1. You are commencing your evening shift as a registered nurse in the local emergency department. You have just received patient handover from the morning shift. One of your patients is a woman who has had a fall outside the local supermarket and has sustained a serious head injury. She is presently unconscious and being prepared for transfer to the intensive care unit. As you approach the family to introduce yourself, you are confronted with a very unhappy and concerned family. One of the family stands really close to you and in a loud voice says, "What's going on? We received a phone call saying Mum has been taken to hospital, and then we are left sitting here for hours with no information from anyone. What is going on?" In the handover, you did not receive any information informing you that the family were here. Scenario 2. You are on clinical placement as a first-year nursing student. The nurse you are working with today has requested that you attend a simple wound dressing on one of your patients. As you are completing the dressing and communicating with the patient, the nurse you have been working with arrives and challenges your technique with the dressing. The nurse states, "You've got it all wrong, just stop what you're doing." The nurse then comments, "Having a student is such a pain, and I really don't have time to deal with your incompetence." The nurse then leaves you alone in the room with the patient, who is very upset with the outburst of the nurse. You try to calm down, complete the dressing, and clear away the dressing trolley. As you leave the room, you try to find the nurse you have been working with to discuss what has just happened. The 1200-word essay plus 10%. Please structure the essay in the following way. Introduction, 150 words. State the chosen scenario and the concepts and framework you will use in your essay. This first paragraph should provide the thesis statement in the first sentence and the overview of main points or brief plan for what will be included in your essay. Identification of the concepts, communication framework and nursing tools, 200 words. Select the concepts, communication framework and nursing communication tool per second to be applied to the scenario. Explain how they are relevant to your chosen scenario. Discuss why they are suitable, including the relevant positive or negative aspects of the concepts, framework and nursing tools that are important considerations for nurses. Write one paragraph here with the first sentence of the paragraph providing the main point, the concepts and the communication framework and their relationship to the scenario. In the rest of the paragraph, discuss their suitability and their positive and negative aspects for nurses, using evidence from the literature. Analysis of the communication scenario, 300 words. Analyze the communication scenario and identify the nursing concepts and governances that have impacted on the interpersonal communication displayed in the scenario. Draw upon some literature to support your analysis of the communication scenario. Use two paragraphs here with each paragraph's main point relating to a reason why the communication in the scenario is not effective. The rest of each paragraph will explain and support the main point by referring to the evidence and relating it to the scenario using examples. Application of the chosen concepts, communication framework and nursing communication tools, 400 words. Discuss how the use of the concepts, framework and tools can improve communication within the chosen scenario, and support your discussion with reference to evidence-based literature. Use at least two paragraphs here, with each paragraph's main point explaining an area of effective communication. The rest of each paragraph will explain and support the main points by referring to the evidence and relating it to the scenario using examples. Conclusion, 150 words. Briefly restate the case scenario and your chosen nursing concepts, communication framework and nursing communication tools, and summarize how they were relevant. Summarize the main ways you applied them to enhance the communication within the chosen scenario. Use one paragraph for this conclusion, restating your thesis statement, providing an overview of main points, and providing a concluding sentence or two that rounds out your learning from the assignment. Writing tips. Refer to current, no later than 7 years, older seminal literature is accepted, academic peer-reviewed journal articles to justify your ideas. NUR1102 Literacy and Communication for Healthcare. Format of assessment. Do not use headings or subheadings. All parts of the essay should be attempted. Margins. 2 centimeters on 4 sides and line spacing. At least 1.5. Font size. 12. Adherence to the stated word limit is required. Use OPA 6th edition referencing style. A full reference list is required at the end of the assignment. For further information on referencing at USC, refer to https://www.usk.edu.au/libraries/referencing. NUR1102 Literacy and Communication for Healthcare. NUR1102 Literacy and Communication for Healthcare. Thanks for watching.